Well, Dr. Johnson, thank you so much for taking time out of your day today. I know how busy you are, so we really appreciate this.
My pleasure, June. Thanks for having me.
Great. Well, before we get started, let's talk about this office and exactly like where it's located in Southport.
Sure. So we're located on Howe Street, on North Howe, and we are very close to the intersection where River Road comes into Howe Street. It's almost directly across from the Walgreens.
And that's a great place to be, directly across from Walgreens.
It is. It's convenient.
That's great. Now, I know that some of our viewers have met you on one of our previous shows, but for those who may not have seen that show, tell me a little bit about yourself and where you went to school.
Okay. So I am originally from North Carolina. I went to undergrad at UNC Wilmington, just up the road, which is where I live now. I did my medical school at a school called American University of Caribbean in St. Martin. I did my residency in the great state of Maine, and I've been back here since last summer.
Great, great. So you joined the practice in 2014, is that correct?
August 1st, 2014 was my first day.
Great. And do you see patients of all ages?
We do. We see infants right through the elderly, and that's what family practice is all about, so that's why we're here.
Like birth to death, right?
Absolutely.
Well, I know you have a partner here, and I believe it's Dr. John Moore.
It is.
Is that correct?
That's correct.
So why don't we kick things off with a tour, and I believe where we are now, this is your main waiting area, is that correct?
This is the main entrance into our office. And
you're on the second floor here in this very nice building, but there is an elevator, so that's great.
Absolutely
great
is.
for patients.
And then check-in is right where we are here.
Okay, great. Well, let's get started.
Okay, sure.
Okay.
And this way.
Thank you. So this is what? This is sort of behind the scenes where everything goes on in terms of business. And is this checkout or check-in?
It's a little bit of both. So checkout is where Heather's sitting right here, and right behind her is check-in. So you exit the same way you enter in this facility. And then you'll also see Heather in the back sometimes helping us out as well. So
good job, Heather. Okay, let's continue around the corner then.
Okay.
So this looks like a lot of charting areas. Is this someplace where nurses would typically sit? Or?
Yes, it is. So this is the main nurses station. We'll also generally have one that sits here. And these are 3 treatment rooms. This is Dr. Moore's side of the office, actually. We have another identical side over there, but all the treatment rooms are basically set up the same. And then Dr. Moore's office is in this corner.
Okay. While we're here, let's talk a little bit about MyChart. I believe that you are on MyChart.
I am.
And what is that website where you access MyChart?
I believe that one is NovantHealth.org.
Okay.
And the cool thing about MyChart, you can go in and check your own labs. You can email providers.
You can email providers?
You can.
So if I'm on MyChart and I email you, because actually you are my physician, so I may be emailing you. And I ask you a question, what can I expect? Because I haven't done that yet.
Right. So the email will make its way to me, and then I'm able to respond back to that email and we can start that dialogue together. And
Is there a time frame where you could expect a reply? Is it generally within a couple days?
It's generally, we try to do it within the same business day. That doesn't always happen, but that's the goal usually.
Sure. Well, that's great. How about prescriptions? Can I refill a prescription? Can I ask for a refill?
You can. You can also ask for prescription refills online as well.
And I believe I can make an appointment.
You can. You can. You actually can. You can make same-day appointments if you want, or schedule out farther.
So I can schedule
as long as there's space available. Yes,
right.
You can.
And you could be able to tell once you're on there. You can see what's available and what's
Yes,
not,
you can.
and I can just click on and schedule that myself. That's pretty cool.
Absolutely.
Now, I understand that you've recently extended hours. Is that correct?
We will be extending them starting June 1st. Yeah.
Okay.
From 7 a.m. to 6 p.m. Monday through Friday.
That's awesome because, sometimes we all work.
We do.
And, we can't take time off work to see you, so that makes it really convenient for patients.
And that's what we're hoping.
Great.
Yeah.
All right, well, let's take a look at one of the treatment rooms.
Okay, sure.
Okay? So this is one of the treatment rooms, and how many do you have?
7.
7, and they're all pretty much the same?
They are. They're set up pretty similarly.
Okay, great. It's very nice. Very nice. I love the floor.
Thank you.
It's
colorful.
It is very colorful. Great. All right, well, let's move on.
Okay.
Thanks.
So now let's take a look at the lab.
Okay, great. I'm excited to see the lab. Okay, we're here at the lab. Now tell me what happens now.
Okay, so this is Karen, our fabulous lab tech.
Hey, Karen.
All of our patients
How
love.
are you?
Good.
So basically, when we order labs, we draw them here. Karen draws them for us every day, and then we send our labs up to LabCorp for processing. So we generally will have the results back the following day and are able to contact patients and let them know their lab results. It's a big bonus for the patients because they're not having to go anywhere else to have labs drawn.
Right.
And because Karen's very good at her job, so they all love her. So it's worked out really well, and patients seem to be really pleased with it.
Great. Yeah, I love the idea of having it right in-house so that you don't have to go anywhere else.
Right.
That makes it much easier on the patient.
It does.
So, great. All right, let's continue.
All right.
So we're here in the other side of the building, which is a mirror image of the side we just visited. And these are predominantly your rooms. Is that correct? Your
Correct.
treatment rooms?
Correct.
And your office is located in this end.
It is, absolutely.
Now, I understand that you've recently added urology services as well as surgical services.
We have. We've been very fortunate that they've agreed to come down here. They're here every other Tuesday. So
Both services are here every other
they
Tuesday?
are surgeries here in the morning, urology's here in the afternoon.
Great.
Which works out well for our patients that we've referred to them, as well as for patients that other providers may have referred to them, so they're not having to go all the way up to the hospital to see them. So it's a little more convenient, and just trying to, add that remarkable patient experience for people and do what we can.
Yeah, that's great for patients who live down this way because then they don't have to travel. And you're right, it's easier for you to make that consult here in the office. So that's wonderful. Yeah. Good for
Worked out
Southport.
well so far.
So I notice you have your own nursing station here on this side also. And we have Melody there.
Melody's hanging out over there today for me, helping me out.
Yeah, so there's one on either end. Actually, there's a nurse's station on either end that
Yes.
makes it very convenient for the doctor.
Absolutely.
Yeah, great. Well, it's been wonderful having this tour today to see your offices. They're lovely.
Well, thanks
And
for
I'm
showing it to everybody else.
And I'm really excited with the new services being provided here. I think that's a great thing for Southport and for the patients who live in this end of the county. So thanks again for joining us
Thank
today.
you.
You're welcome.
All right.